Looking at a side view of
Side
the
view.
cervical spine.
This is the front,
Yes.
this is the side view. It's like this.
Yes.
Okay.
All right.
Okay, the levels are clearly indicated here. You can see this is the levels
Yes.
of the vertebrae.
Yes.
Okay. Let me first show you what a normal vertebra and the disc will look like. You can
Yes.
see somewhere here. This is C7 and T1. This is the bone and
Yes.
this is the disc.
Yes.
And then at the back here, this is known as the spinal canal.
Yes.
This is where your spinal cord passes through. Okay,
Yes.
you can see the spinal cord clearly here.
Correct.
All right. So the thickness of the disc should be something like this.
They should be uniform throughout.
Yes, it should be uniform throughout.
Yes.
If you look at it carefully, you can see the C5 and C6, the disc
Yes.
is rather thin down.
Narrow,
okay,
yes.
narrow. And also C6 and C7 is also same.
Yes.
And then there is a bit of a bulging of the disc into the spinal canal. So now let's look at the axial view. Okay, this is looking at the spinal canal like this view.
Yes.
All right. We want to see how big the space or the path for the spinal cord to pass through.
Yes.
The more wide area you see, that means it's very spacious.
That's
Right?
healthy.
That's healthy. And at the same time, you should. Are you able to get this? This
Yes.
will indicate the level. No, you just put it from far.
Okay, got it.
This is it. So
Sure.
as I scroll down,
Yes.
you should be able to see where we are. Okay, this is C3, C4, still very good.
Yes.
Very nice,
113 by 113.
Yeah.
Is that an area in millimeters?
What do you mean?
Square millimeters. The FOV 113 at the bottom there.
No, the one actually, the truth is even I am myself, I don't know what is that.
Oh, okay.
This is for the radiologist to decide.
Okay.
As we go down, it's still okay. This is the spinal cord.
A
There's
little
still
narrow, maybe a little narrow on the left.
slightly narrow, but still
Yes.
spacious enough. It's considered very good.
Acceptable.
Very good. Still very good. This is C4, C5. Okay. Now we are coming to C5, C6. Now you see that?
Yes.
The white area is much less now.
Yes.
And then I can see the disc. This is the disc that has come out. And also it is the, what do you call that? This the path for the nerve root to pass out.
Yes.
At each level,
Yes.
there's this foramen here on the sides, right and left on both sides.
Yes.
So the nerve roots will come out. The spinal cord is passing through here. And then on the sides, at each level, there'll be a branch coming out. And the ones that comes out from here, they're heading to your upper limb. So if there is a stenosis or compression of the nerve root here, you will feel the pain radiating all the way along the path of the nerve root, heading towards
The
here.
fingertip. Yes. And including the shoulder blade.
Including the shoulder blade. So
Okay.
this is at C6 and C7. I can see that there's a disc here
Yes.
blocking the foramen. And also the C5, C6 also I think is a bit tight. Okay, this is C5, C6. The exit foramen seems to be narrow. The exit foramen is definitely narrow. Compared to the ones higher up, you can see how
Yes.
you can see it's
They're wider, yeah.
wider. This is wider. C4, C5.
And that one there, it's completely absent?
No.
Or is that fine? Those ones that you went through earlier, like there where you don't have anything.
No, this is
there.
bone. This
see.
is the bone. The bone on the side.
I see. Okay, so that's fine. There's
So
no nerve
if you
there.
Scroll, there's no.
Okay. And that's the nerve. Is that the
Yeah,
white?
this is the C5, C6.
nerve
I
tissue.
feel the one on the left is definitely narrower, and
Yeah.
also the C6 are here. 6 and 7 also is narrow.
Okay.
There's something here.
Wow.
You know?
That's scary.
Yeah. Okay. What can we do about it? It depends on how bad the symptom is. If it is like with time, it seems to be getting worse, then definitely you need some sort of surgical procedure.
Yes.
But if you feel that, yeah, it is there, you can feel that discomfort in the background.
Yes.
But most of the activities you can do normally. You can sleep well, you can move well, the grip strength is good. Then we can try medication and physiotherapy.
Okay.
But in order to do physiotherapy, you have to be in a place where you can regularly go and do the therapy.
Understand.
You can start off conservative treatment. That means medication plus physiotherapy for a couple of weeks. If there's good progress, then we're on the right track. Then you can just continue until you feel much better. If there's not much improvement, maybe just a bit of an improvement, and then after that it's kind of a plateaus the improvement, then it's still time for you to consider surgical intervention.
Okay. All right. So, do you think today then you will give me some kind of medication to start healing, like we discussed
like
in the
we
first?
discussed yesterday?
Yes. So it'll be something to start healing the nerve. Is it for the nerves really? But it's obviously
it won't change
the physical, the structure cannot be
is
changed.
still the same.
Yes. So how does this medication actually help the nerves?
You can
to
simple
heal?
terms like a nerve modulator, because something externally is irritating the nerves. The nerves are like electrical wire. The moment you irritate the nerve, it sends wrong signal to your brain, right? So in order to, you can say like stabilize the nerve function. But once you take for several weeks, then you start noticing improvement. It's not a painkiller, so it won't be instant pain relief. You have to take a couple of weeks to see the improvement.
And I could take Panadol, etc. in the meanwhile. for that.
Panadol will be more for pain.
Yeah, but that's what I mean, just for the pain management to a degree, yeah. Because it does impact on my sleep quality.
This
At
is
times.
an important symptom to consider.
Yes, when I was having my MRI yesterday, it was incredibly painful, lying
Because
on
of
the
the
on the
posture.
scapula. Yes, the
Because of the
scapula was
posture.
burning intensely.
Yes. That is a referred pain.
Yes,
The one that you feel over the scapula is referred pain.
correct. I understand because that was damaged. So this damage probably occurred during that bicycle accident, more than likely. Because I landed on my neck and the scapula.
It could have aggravated, but the accident was many years ago. You
Yes.
said it's more than 10 years ago.
Oh yes,
Right,
but could that not have
It
impacted?
could have, yes.
My neck has felt strange since then.
But then your injury was here.
Yes,
Right,
and so I landed on the scapula
Possible it
and the
could
neck.
contribute, but you must understand even age-related factors comes into play.
Yes, so it's pretty much wear and tear of a potentially
Yes.
injury. So what is causing the pain is this structure, this damaged structure, this imperfect structure, which is now is it an impingement pretty much?
Yes, definitely.
100% an impingement.
Yes, at 2 levels, C5, C6, and C6, C7.
Okay, and there is a small chance, perhaps, that it will resolve itself if I'm careful and I don't overdo
No,
things.
it won't resolve inside. There's no way it's going to resolve inside. Now,
Gotcha.
what we are discussing is management of your symptoms only.
Yes. So when I said resolve itself, I did not mean that the structure would magically heal itself, because it's degraded. What I mean is that these symptoms may attenuate.
Yeah.
They may soften,
Yes.
become a little less in the
much,
next
much
few
less.
weeks if I just take
Next
it
few
easy.
weeks, yes,
Okay. And especially with the medication.
with medication and physiotherapy.
Okay. So I want to go to my next work away, which is going to be very easy. It's not going to be labor, but I want to leave on Saturday. So is there anything that I can look
No,
online?
there's absolutely no contraindication for you to travel and do things.
Okay.
Because you have no weakness or anything. The only significant symptom I would say is the numbness on your index finger.
Yes.
But even that, you told me it's like 7 out of 10 kind of numbness, slight numbness.
Yes.
So you have to keep an eye on that. And also the other important symptom is the disturbance of sleep at night. That is one of the important symptoms that normally patients are very annoyed.
Yes.
But your daytime activity is okay.
I just take it easy. I walked from my hostel 1.5 kilometers, and it does cause a certain amount of discomfort and tingling, but it just depends. I raise my hand sometimes above the shoulder like that, and that seems to alleviate. So maybe it may also be the posture of the neck. It obviously is. Maybe I'm not walking correctly, and I was taking photographs of one of the newspapers, the Borneo Post downstairs, and I was keeping my head.
Yes, your posture.
And then it started again.
And started again.
Yes.
So these are the symptoms you must monitor. If after taking the medication, the symptoms kind of slowly, gradually disappears, then fine. But just remember, in future you will have similar episodes.
Yes. Yes.
The question is how frequent the episodes are going to be and how intense the episodes are going to be. If the frequency is kind of every couple of months, you struggle with this kind of symptoms, you cannot sleep, you cannot do like lots of activities, you cannot concentrate on the things that you want to concentrate on, then I would say it's time to consider surgical intervention.
I will
for
do.
sure.
I will do.
Because quality of life will be severely affected.
Okay, and what are the risks of this kind of surgery?
Personally, I do not conduct this surgery. I normally refer my patients to a neurosurgeon.
Okay.
So they are in a better position to explain the risk involved.
Okay, sure. And then what are the side effects of the medication? Potential?
Potential side effect, the one I'm going to give you is Lyrica. I start the Lyrica in a very low dose. I don't go to a high dose straight away. I start gradually. So I'm going to give you 50 milligram twice a day. But still some patients experience the side effects like giddiness and they have some nausea. And the other thing I always remind patients is don't expect symptoms to improve within a couple of days. It's not a painkiller. It takes time.
Okay.
Normally you have to continue taking it for at least 2 weeks before you start seeing improvement in symptoms.
And the duration, you
have to, the first round is at least 6 weeks.
Okay. So I'm going to get a 6 week dosage now, and then I'll
course of Lyrica at a very low dose, 50 milligram twice a day, together with a nerve vitamin.
Okay, so a form of B12.
Yes.
Okay, is it cyanocobalamin or methyl?
No, I'm going to use something known as a bionerve, a combination of few types of vitamin B.
Okay. Okay, great.
And what else? For pain, if the symptoms are significant, then I'll give you something for the pain.
Okay, thank you.
Purely to manage the pain.
Okay. Okay, great. And then
physiotherapy is the other thing, because I personally feel that medication together with regular therapy, is it's more effective.
Sure. No, I agree with that. It's just the
but
time.
But because of your traveling, schedule, then it's going to be difficult for you. But as long as you are here, you can always make an appointment, come and see the therapist.
Okay, so will you refer me to them so I can reach out to them?
I'll do that.
Thank you very much. No, I really appreciate it. And then the question also is, when I return to South Africa, I'll be back in 4 weeks. Then follow-up medication. Is there a letter you can give me?
You mean you're going back to South Africa
yes.
in
4
a month's time?
Yes, I'll be back there.
Or you want a medical report?
If possible, sure. So that I can say, And then the CT scan. I know you said they give
this
that to
will
me
be given to you in a CD and disc format.
All right.
But you can always, like just now you took a video of that. There'll be CD also.
Okay, great. Because I was thinking I could leave that at my hostel if I get it before Saturday, but otherwise I could fetch it when I come back.
No, the disc will be given to you immediately.
I see. When I go downstairs now.
Bila dia akan teruskan disc. Normally, as far as I know, immediately you can collect it.
Oh, okay. So I should go to the.
You can go back downstairs.
Okay, I'll do that.
Yes.
All right. Thank you.
Medication, physiotherapy. Maybe you can go and start today, because you're leaving on Saturday, right?
Yes.
You're planning to leave on Saturday, so you can start the therapy today.
Okay.
In fact, you can even do daily if you want to.
On my own. You mean once they show me how? Or is there going to be?
Because if you go and see them, they will use certain types of machines.
I see.
Things like laser treatment, like ultrasound treatment.
Okay.
They got a few types of modalities they use.
Do I go back to registration now and?
No, you have to go to first floor. Later maintenance will.
Okay, sure. Thank you so much. I think you've answered all the questions, and I have two friends in South Africa who I posted this to Facebook, my previous post, and they have had the same problem, and both have had that procedure. I forget the name.
Surgical?
Yes.
Surgical or just some sort of injection?
Well, at least one of them has had the surgery.
Surgery done.
Yes.
There are a few types of surgery.
There was one started with an L, I think. L-stomy or something like that. Anyway.
NCDF is what we normally will do for this.
Okay. All right.
It's a decompression plus fusion of the affected level.
And that's something you do, but you also refer
No,
to
I don't do
these?
spine surgery.
Only
I will
neurologists.
refer to the neurosurgeon.
Okay, sure. And they handle all the disc issues.
The surgical part they handle.
Okay.
But like I said, most patients can be treated conservatively.
Okay. Fingers
but
crossed.
you must give a reasonable time frame.
Yes.
I would say about 6 weeks is a reasonable time frame. If you see good improvement within 6 weeks, then be on the right track. Maybe conservative treatment will be able to solve your symptoms.
Okay.
But in this 6 weeks period, if the symptoms initially reduce but eventually it plateaus, then you have to consider surgery.
Okay. You've spelled it out clearly.
All right.
Yes, thank you. That's much appreciated. I'm glad I